When patients ask me about erectile dysfunction, they ask, well, can you help me with that? And what I tell them is, I do male enhancement. It's penile enlargement. Now, there's a difference here. Let's review what erectile dysfunction is. Erectile dysfunction is when a man cannot get an adequate erection. This happens to millions of men. It's a pretty significant issue. So as long as we know what the cause is, and then we can learn how to treat it. I usually recommend the patient to go to their primary doctor, because it could be a simple medication they're taking. It could be undiagnosed diabetes, for example, or some other disorder that can cause erectile dysfunction. Now let's say everything's good and everything's fine. It could be simple aging causing the problem. So in that case, you might consider a Viagra or Cialis type medication. Now after using that, if that's not adequate, you'd move up to a bimix or trimix injectable, right, or a suppository. Other remedies would be, if it's more severe, put an implantable in. It's a erectile, it's an implantable device that you pump that actually puts water or fluid into the tubes that are in the penis. It's artificial, right? The tubes that go inside the penis. And you kind of balloon it up. There's a little valve in the scrotal area. And you just pump, and it gets erect. After you're using, you just deflate it. So as you can see, there are many remedies for the erectile dysfunction. Now, how does that tie into what I do? My job is to increase the overall size of the flaccid penis and the erect penis, or the girth of the penis. So for example, if someone has erectile dysfunction and they want to get larger, well, I can certainly do that. But I cannot provide the blood flow into the penis, because erectile dysfunction means you cannot get blood flow into the penis and get an erection. What I do, assuming that problem is solved, if someone wants to enlarge the penis, right, the girth, let's say their girth is 4 3/4 inches or 5 inches, and they want to go from, let's say, a relatively average girth to, something like that, 7 or 7.5, that's where I come in. I could put a permanent filler. The filler is injected. It's an injectable process. We put the filler in the skin and superficial areas. Over a 30-day period, it stimulates the body to form collagen, your own natural collagen, and that's permanent. So after we do our treatment, you might need 1, 2, or 3, depending on the size you want. We'll increase the size of the penis. So when your erectile dysfunction, if you have it or not, if it's rectified and treated properly, and then we make you larger, then as you get your erection, now you have a full erection and you're larger. Erectile dysfunction, and what I do, male enhancement and enlargement, are really two separate items. One has to be treated typically with medications or an implantable device, and the enlargement process has to do with an injectable permanent filler, right? It's permanent for life, and that is a separate step. That's what I specialize in.